Welcome to the Ortho Reports podcast. Today, we've got a case that honestly reads more like a high-stakes thriller than a medical journal. It's an incredible story about skill, about hidden dangers, and about that razor-thin line between a miracle and a total catastrophe. So yeah, let's get right into this surgical tightrope walk.
This is really the heart of the matter, isn't it? I mean, imagine a patient comes in. You think you know the problem, the surgeons have a plan, but hiding right there, just out of sight, is a complication so dangerous it could turn a fixable problem into a fatal one.
At the center of our story is a 14-year-old kid. Over about a year and a half, his own body was failing him. Just walking, something we all completely take for granted, had become impossible. And the source of this whole devastating decline? It was a critical problem, hidden deep inside his neck, right at the top of his spine.
So let's really dig into how serious his situation was. Because by the time he made it to the spine clinic, his life had already been turned completely upside down.
The reality of his condition was, well, it was grim. For 18 months, he'd felt this growing weakness in his arms and legs. It got so bad he couldn't even stand on his own, and he was losing control of basic bodily functions. His doctors saw his reflexes were way over the top, a classic sign that the signals from his brain were getting seriously scrambled on their way down. The diagnoses they landed on? Supra-axial cervical myelopathy. In plain English, his spinal cord was being severely squeezed right up high in his neck. Now, to put a number on this, doctors use what's called the Neuric scale for myelopathy. He was a grade 5. And let me be clear, grade 5 is the most severe category. It means you're essentially wheelchair-bound or even bedridden, totally dependent on other people. And that's where this 14-year-old boy was.
So, with the problem identified, the medical team starts digging for the cause. And what they find is a diagnosis with two very, very sharp edges. Okay, so the main culprit here was a condition called Atlantoaxial Subluxation, or AAS. Just think of the top two vertebrae in your neck, the C1 and C2, as this crucial pivot that lets your head turn. Well, in his case, those two bones were way out of alignment. This created a really dangerous instability right at the spot where the spinal cord leaves the brain.
An MRI scan showed just how bad things were. His spinal cord wasn't just being pushed on, it was being crushed. The cerebral spinal fluid, the stuff that's supposed to act like a protective cushion, it had been completely squeezed out of the picture. This was a flat-out neurological emergency, and the solution seemed pretty clear: surgery to realign the bones and get that pressure off his cord. But just as the team was locking in their surgical plan, some more advanced imaging came back, and it revealed something else, a hidden variable that changed everything and turned an already tough surgery into an unbelievably dangerous one.
What they found was a rare and incredibly dangerous anomaly. One of the main arteries that supplies blood to the brain, the vertebral artery, it just wasn't where it was supposed to be. It was taking this bizarre path directly in the way of where the surgeons needed to place their stabilizing screws. One wrong move, even a millimeter slip of the hand, could tear that artery open and lead to a catastrophic stroke or even death right there on the table.
Now, you might think this was just a case of unbelievable bad luck, but the data actually tells a different story. While this kind of anomaly only shows up in about 2 to 3% of the general population, the rate skyrockets to a staggering 20% in patients who have congenital issues in that exact same spot. We're talking a 1 in 5 chance, which just goes to show you how absolutely crucial those pre-op scans really are.
So the challenge was set. The surgeons had to decompress the spinal cord, but to do it, they had to navigate what was basically a biological minefield. Their plan had to be just incredibly delicate and precise.
So here's the game plan they came up with. First, they went in from the back of the neck. Then came the most critical heart-in-your-throat part. They had to meticulously dissect and gently pull that wandering artery out of the way, without damaging it, just to see the bone. Only then could they put the screws in to stabilize C1 and C2, pull everything back into alignment, and finally, clean up any bone fragments to make sure the spinal cord was totally free. The last step? Fusing the joint with a bone graft, so it would stay stable for good.
And don't get me wrong, the risks were huge. The medical literature shows that even with the best surgeons, the risk of nicking that artery during screw placement is around 4%. Now that might sound small, but a 1 in 25 chance of a life-ending complication, every single movement had to be perfect. Against these incredible odds, the surgery was a success. But the operation itself was really just the first step on a very long and challenging road back to a normal life. His recovery was not some overnight miracle. I mean, his body had been through a massive trauma. 4 days after surgery, he actually needed a tracheostomy just to help him breathe. But slowly and steadily, he got better. 2 weeks later, he was off the ventilator. At 6 weeks, his muscle tone was back to normal. 6 months after being unable to even stand, he was walking with a little support. And then, at 18 months, he was walking all on his own, back to his life.
The transformation is it's stunning. He went from a neuric grade 5, total dependency, to a neuric grade 2, which means he has only minor symptoms and can walk completely independently. This wasn't just a successful surgery. This was giving a kid his life back. So, what can a single extraordinary case like this really teach the wider medical community? This is where we kind of zoom out from this one patient to the bigger principles of care. The key lessons here are really powerful. First, this case is a huge reminder that you can never be too prepared. Using advanced imaging like 3D CT scans to find these hidden anatomical landmines isn't a luxury. It's an absolute necessity. It also proves there's no such thing as a one-size-fits-all. Every single plan has to be tailored to that specific patient. And finally, it offers a ton of hope that even in the most complex, dangerous cases, an incredible neurological recovery is possible with meticulous, patient-specific care.
And that really leaves us with a final thought. This was the story of one boy and one surgical team and one hidden artery. But every time a case like this is successfully navigated and then shared with the world, it redraws the map of what's surgically possible. It provides a blueprint for other surgeons, making a once terrifying procedure just a little bit safer for the next patient and for the one after that. Thank you for joining us today on the Ortho Reports podcast.